city town hall meeting with a great round of guest speakers. I want to first open by thanking everybody in our community for all that everybody is doing to help with the stay home order. What we are doing is helping to keep our community safe. We're keeping our family safe and our friends safe and our general community. And I know this is hard. It is very hard. And this crisis has hit every facet of our community, from the children who are not at school to the parents who are juggling, working and having their kids home, to the seniors who are missing their activities and who are really urged not to leave under any circumstances, leave their homes. It's also really hit the economy of our community. So many people are now out of work in our city, and just to see our small businesses and all sectors of the economy struggling, it's a really, really tough situation. And we are all in this together and we will make it through, but we just have to keep doing what we are doing. The more strict we are with our stay-at-home orders, hopefully the quicker we can get out of this. So thank you for everybody who's participating today for the City of Calabasas COVID-19 Town Hall. Meeting virtually today and joining me are Mayor Pro Tem James Bazagian, Dr. Frank Alvarez from the LA County Department of Public Health, Dr. Tanya Altman, Calabasas Wellness Center, Acting Chief Drew Smith, and Community Services Liaison Megan Currier from LA County Fire Department, Lieutenant Hector Mancinas from the LA County Sheriff's Department, Dr. Dan Stepanowski from the Las Virgenes Unified School District, Mark McKee, Viewpoint School, Dave Peterson, Las Virgenes Municipal Water District, and Bridget Carl, Calabasas Chamber of Commerce. Also joining me today are our city staff, Dr. Gary Lysick, our city manager, Robert Yalda, Director of Public Works, Maureen Tamori, Director of Community Development, Jim Jordan, Director of Public Safety, and Jeff Rubin, Director of Community Services. Before I turn this on to Mayor Pro Tem Bazagian, I just wanted to let the city know that a new executive order will be signed later today by our city manager that will be announcing new guidelines on face masks. It will state that everybody leaving their house for essential to go to the supermarket and essential services needs to wear a mask. It will also require that employees at our supermarkets and our pharmacies are also wearing a mask. We will also have stricter provisions regarding construction in this community. And this will all be outlined in information that we will get out to the community later. But this will go into effect on Friday. So anybody leaving their home to go out will need to wear a mask, and all employees at restaurants and grocery stores will need to as well. It's just one thing. Another thing we're doing to try to keep our community safe. And with that, I will turn it over to Mayor Pro Tem James Bazagian. Oh, James, just unmute.
Okay, sorry. I don't have a whole long list of things to say. I did want to note that just this seems like a very unprecedented experience. The city's gone through a series of fires, including one most recently in 2018 where we had to evacuate. We had 20 years plus years ago, we had a series of floods and landslides that many of you will remember throughout the city that impacted some homes greatly. And we had the 1994 earthquake. But in all of those, I don't seem to remember this level and this length of a basic shutdown of services and a change in the way of life that seems like it's gonna last a while. So that was just my little historical note. But thank you, Alicia, for doing this. I'm glad you arranged it, and I think it'll be very informative for the public.
And with that, we'll turn it over to our city manager, Gary Lysick, whose idea this was to get everyone together, and will be moderating today. So thank you. And for all of those people that are writing in with questions, those will be answered by staff. Just right, probably not at this moment, but we will get back to you during this.
Very good. Thank you both, Alicia and James, for your opening statements and remarks. They're very important. And as previously mentioned by the mayor, thank you especially to our panel of experts and community leaders who are here with us today for this virtual town hall meeting. And thank you to the members of the public. I see 118 of you out there right now who are here to gain information and understand about the COVID-19 crisis and how the city of Calabasas is responding. For those joining the meeting and not talking, please mute your microphone so as not to interrupt the meeting. But before we all begin, I'd like to make just a brief opening statement. And despite being closed to the public, the City Hall continues to function, making certain that our city streets are safe and that our infrastructure is well maintained. Our library and community services departments are videotaping events which were otherwise regularly participated in person. And these items are being made available on our city's CTV channel. Trash service provided by Waste Management will continue throughout the city. And to my knowledge, all planned maintenance outages from SCE have been postponed until after the crisis has ended. Only critical repair items are being addressed at this time. Planning, building, and safety inspections continue, some even remotely, which is actually kind of cool. And unfortunately, to allow for proper social distancing, parks and trails have been closed. Do visit the city's website for up-to-date information as more become available. And I would ask that questions be held until after all panelists have spoken, with the exception of our first presenter, who has a very tight window of opportunity to be here with us today. If you wish to ask a question of a panelist member and you're joining meeting via Zoom, using a computer or a mobile app, please press raise hand and you will be recognized and asked to speak. If you're joining by phone only, press *9 and you will be recognized. You will be unmuted so that you can address the panel. Please state your name and the city in which you live. And then once your question has been asked, your mic will be turned off. Just to remind you that this meeting is being streamed live on the city's website and or on the city's CTV channel 3. And with that, at this time, I'd like to introduce our first speaker, Dr. Frank Alvarez from the Los Angeles County Department of Health. I believe he's on the phone. Doctor?
Yes, well, thank you, and thank you, City of Calabasas, for having me back to address your residents and all. It's been, I think, about a month, and obviously a lot has changed. I'd like to again thank all your residents in your city for being so proactive and even moving, as the mayor mentioned, towards the cloth face covering new guidance, and that really aligns well with California, the governor, certainly the mayor of Los Angeles, who went out yesterday, and the county of LA as well. And I think that is says a lot about the city of Calabasas being in step with, really in sync with a lot of the work we've all been doing up and down the state. We've been quite fortunate, quite honestly, to have the strong leadership we have on all levels in California. Again, would like to thank you and your residents for being so proactive in ensuring that we stick to the stay at home. The update from my perspective is quite sobering. I'm sure many of you have continued to see the statistics as well. It is obviously widespread, the COVID virus. When I addressed the city about a month ago, we knew at that point that we were quite a bit behind the 8 ball just because of the testing and the lack of testing. And now we're seeing, as the testing's catching up, it's no surprise that we're seeing hundreds, 500s of positive tests almost every day. A lot of that speaks to just having a lot more tests to test folks than we did at the start. So obviously this bug has been circulating for some time, and I think that's no surprise. So as of yesterday, we actually, the county of Los Angeles reported another 550 new cases, and really sad to report another 22 deaths as well. So that brings our total in the county to 6,910 cases and 169 deaths to date. In the city of Calabasas, there was 20 to date cases reported. In the valley of San Fernando, we have close to, I think it's a little over 1,600 or 1,300 cases. To an extent that we know a virus doesn't recognize any boundaries, and it is all the more the reason for us to stay safe, stay at home. I know it's, as the mayor mentioned, and as we all know, it's been very, very difficult for us on many levels, emotionally with our families, certainly economically as well. So I do feel, however, in that we could get through this together if we all take responsibility and play our part. We've seen that around the globe, how with strict stay-at-home, strict social distancing, covering cough, good respiratory and hand hygiene, with time we will get through this. We will flatten this curve, and we've seen some early signs of this in San Francisco and the Bay Area. They're starting to see some where they've probably hit their apex and summit, and maybe some encouraging signs even out of this in New York recently as well. We do have some signs in terms of how this may be slowing down even here in Los Angeles. It may not reflect it in the numbers as of yet. We're probably going to continue to see 500 plus cases a day, just again, as we ramp up more testing. But the efforts certainly, when we talk about flattening the curve, it's not so much coming down quickly off the outbreak, but it's actually allowing less cases, less active cases, and ultimately less real serious cases hitting our hospital infrastructure, which we're trying desperately to maintain in terms of having capacity throughout the county. And again, it's one of these, we're in an emergency response up and down, again, federal, state, and local levels, where we're in a mutual aid sort of response. So it's not like every city or sector for itself. I mean, we're planning this countywide and statewide to make sure we have the appropriate and ready allocation of PPE for healthcare workers and ventilators as well. So all of that has been 24/7 around the clock in terms of our emergency folks, and you'll hear from some of these speakers as well from the county on where they're at as well in terms of their engagement. Again, I can't emphasize enough, like the mayor mentioned, without a vaccine, and knowing this is widespread, and knowing as well over the last several weeks, this has become clearer and clearer that this bug can spread without symptoms before you even get sick. So it's a bit like the flu, where you can have transmission before you even feel crummy or get a fever. And again, all the more reason to stay at home, to social distance. Now we've got the face covering, and we refer to it as kind of a cloth face covering. And you could go to the city site, you could go to our site, CDC, and even the state site to get more information on how you could make a cloth face covering, guidelines around that, how you could wear them. But it isn't. What it isn't is N95 and surgical masks. We really don't want the public to go out and acquire more N95s and surgical masks. We should save all those for the folks that are truly on the front lines, our healthcare workers, and make sure that they have what they need to be safe on that front line. These are more cloth, bandanas, scarves, material such as those. And again, I encourage you to go to the website to get more information on that. But basically, it's to protect, quite honestly, others from you. So if you may be coming down without even knowing it, and we do know even by speaking, you're going to be, there's a certain low level of virus particle that could be transmitted. Again, days before you even may know you're coming down with this thing. So if you're out for essential services, like the mayor mentioned, make sure that indeed you're covered with a scarf, a cloth, a bandana of some sort, so you're not, in essence, have the possibility of transmitting to other. So again, it's it's just, this is going to be a tough couple of weeks. I mean, we do know that every day, we're seeing it more and more widespread. So certainly it's getting risky and more risky to be out and about. And hopefully we've discouraged, I know we've closed so many venues and we're trying to close all those loopholes, but it's really all of our responsibility at this point for the next couple of weeks to really hunker down, to continue to flatten that curve. We know we could get there, and we know there's a light at the end of the tunnel. So, I just, again, applaud you for putting this together today, and your residents for being strong and resilient, in Calabasas. So thank you again for having me on today.
Frank, just one question. The masks are really to be worn when you're going for essential services, but what about when people are on walks in the community and might come into contact with other people? I don't want to give out the wrong information, so I'd rather you address it.
Sure. Yeah, and then the guidance there is, again, if you're out and like you're jogging, recreating, and you're by yourself, I mean, you might want to carry your scarf or your bandana with you, but certainly you don't need it if you're out, jogging around. But it would be a really good ideal if once you're if you're close, if you could, if you can't avoid kind of being within some distance of somebody, to put the mask or put the face covering on. But again, the outdoors is less of a risky proposition. Once you're indoors, absolutely. I mean, folks should be with these coverings.
Great, thank you so much.
You're welcome.
Excellent. That was a question that came from a member of the public, and so thank you for that. It was part of the chat. But at this time, for the doctor, before we let him go, and following the protocol outlined earlier, are there any questions from the public, from now the 137 of you, that may have questions to be asked of Dr. Alvarez? And I would ask Tony Yin, I believe you're there, to help me to look and see if anybody does have questions, if they're raising their hand or if they hit *9 on their phone. And meanwhile, while that is happening, I'd like to ask a question. There's some question about when this crisis is going to reach a peak in the Los Angeles area. Do you have an estimate of time of when it's going to start to plateau and when there's some semblance of normalcy that we might expect?
It's that's like the $64 million question there, and it's tough to say. I mean, it's based on what we've seen around the world. If we really hunker down, it's really as, I don't know if folks have been listening to Anthony Fauci, but it's one of those things where we don't dictate to the virus dictates to us in terms of timelines. But if we're really hunkering down, if we're really separating, social distancing, it's going to make it really tough for that virus to continue to circulate at an accelerated pace. So we're hoping, we see, we've been a couple weeks behind San Francisco. I think we're still going to, get hit in the next several weeks. And hopefully if we get through that, continue to maintain and increase our social distancing and stay at home, we're hoping for, maybe hitting that summit within weeks or a month. It's a locomotive. I mean, you've got something coming down the track. So even once you pull your foot off that gas and we know we hit the summit, we're going to still be seeing cases on the way down as well. So we'll have to have a strategy that phases things. It's unfortunately not where you can open everything up at once, because again, although we just heard from China and Wuhan that they finally opened things up, and they're 3 months out, almost 10 weeks or so. So, so if, somewhat that's an encouraging sign. I mean, again, if we do practice, strict guidance here in behavior, I think we could flatten this curve. And I really do think once we come on the way down, public health will even have a better chance of continuing to isolate and quarantine folks, which would add to another tool to be even more effective as the numbers start reducing. So, so again, it's a tough one to call, but and I do feel for all of you out there that, you know, I know we're going into kind of our religious celebrations, you know, and holidays here with Passover and Easter, and you know, all the more reason to try to stay connected with your faith faith community in a way. Many of them are being very resourceful, I hear, either online or other venues, to keep their folks at a distance and at home. But please continue to do what you can to stay strong spiritually as well as mentally. Thank you.
Oh, well, thank you. There happens to be a person from the audience, if you will, an attendee of this meeting, Craig Shearer, and I'm trying to unmute him so that he can ask a question. And with the aid of my IT expert, I'm hoping that we can accomplish that. Craig, do you hear me?
He's there. Craig, if you can just unmute.
Okay, I unmuted. Can you hear me now?
Yes.
Yeah, Craig, thank you for joining us today. And Dr. Frank Alvarez is ready to answer your question.
Hi, Doctor. My name's Craig Shearer. I'm also a member of the Calabasas Chamber of Commerce. I've been in the HVAC business for over 30 years, and I've had a lot of calls pertaining to the services we provide, which is related to indoor air quality. And I just wanted to get your feedback. I've been seeing a lot of reports in the news media as well in regards to ultraviolet light combating viruses on indoor homes and businesses. Do you know anything about ultraviolet light, and is it beneficial?
Uh-oh. Doctor, your mic is on mute.
Oh, sorry. Well,
Okay.
we do know that ultraviolet light is effective at, over some period of time on killing, obviously bacteria and viruses outdoors with the sun. As things desiccate and light causes, them to, denature in a sense. We also, the mode of transmission for COVID is similar to, again, the flu. I mean, it's larger respiratory droplets, so they tend to fall to the ground within that distance, of 3 feet, a meter or so. They're not effectively aerosolized. I mean, maybe through a high-risk procedure that somebody like an intubation or some sort of procedure where it might expel a lot of virus. But other than that, it's not similar to like the measles or tuberculosis, where it is much smaller, what we call less than 5 micron sort of particles that do aerosolize, and where you would need like these fancy isolation HEPA-filters or HVAC systems, and need to be in a negative pressure isolation room and all that. So that has given us an opportunity. Initially, we didn't know. So initially, we put all suspects into hospitals and into these very high HVAC sort of negative pressure isolation rooms. But now that we have a better sense of how this is truly, how it's transmitted, we were able to move towards just droplet precautions. But in terms of industrial HVAC sort of ultraviolet system, I know they use that with tuberculosis. I know they use it with other aerosolized, sort of particles. But again, I don't want to say simple, but with routine disinfection around the household, again, washing hands, covering cough, that's what you really need folks to be doing. Thank you.
And thank you for that question from one of the attendees. But I do have just one more question. There's a couple more questions on the right. I'll have to read them, and then I don't think they want to say the question, so I'll say it on their behalf as long as we still have some time. But while you're answering, I'll go through their questions. This question I would ask of you: what about the use of leaf blowers? I mean, you talked about aerosolizing, if that's the right word, this in very small particles, but does it make sense for the community at this time not to use leaf blowers, or is that something that we shouldn't be that concerned about?
Yeah, I wouldn't be that. I mean, outdoors with leaf blowers, I don't think that's an issue with transmission of this particular bug. Yeah, so I wouldn't be that concerned about leaf blowers.
Very good. And I don't know. Some of the other questions on here, I will send back the answer to the members of the public who were asking. Basically, if all the parks are closed, and where do elderly go for exercise? That was one of them. They don't want to walk on city narrow streets where they can come in close contact with other people. Do you have a recommendation for that and how elderly people can exercise safely during this crisis?
Boy, that's really going to have to be, in a sense, customized per like region, city, community, in terms of what's accessible. Again, being safe. I mean, going out with, if you're going out with a family member that I would encourage that for some support if they're within your household. But other than that, I'd probably have to refer that back to you guys in terms of what might be available there in Calabasas, in terms of just maybe any accessible pathway for the elderly. But I would certainly encourage it, whether it's indoors, at home. I mean, try to stay physically physically active the best you can, because obviously we know that's really helpful for your body and your mind. So, whatever way you could find to stay active, I would certainly encourage that.
Well, thank you. That did answer that. And I got a couple other questions while you were talking, or at least responses. One person says that I exercise in my house 10,000 steps a day with weights. That was from a woman in the community that we all know. And that's a lot of steps. And so, yeah, very good. And then just to get rid of one thing that someone brought up here, it says, I've heard that the biggest transmission is between family members. Like when one family member goes out to work and then they bring it back home. What should be the common practice for family members at home for practicing safe social distancing, sir?
Well, we know that certainly if you're in close proximity and if a family member, for example, we've seen that with some cases with healthcare workers, and we know that they're at obviously a slightly higher risk, and some have taken the practice, quite honestly, of either separating themselves when they get home to a room that has an independent bathroom, just to take extreme precautions, kind of. And then others have actually just stayed, in some other facility. But routinely, unless you're really at, a higher risk occupation, there isn't a need to really, completely distance yourself within your bedrooms and all that. I think it's just important to again have good hygiene, disinfect around the house, disinfect, wash your hands, disinfect, again, limiting your exposure whenever possible, unless it's essential, to go out to do and touch anything out in a market or where there might be other folks touching things. But yeah, I mean, so it's really tough. I mean, it's tough to, you still gotta, get things done around the household and work with, your family members. Again, it comes back to just strict hygiene, when you're at home. And I think that's the most important thing, quite honestly.
So there's so many questions coming in, but I know we have other panelists. Frank, is there an email address, or is there a way for us to send some of these questions to LA Public Health and get some of those answers, and we can post them on our website? Because I know people also want to hear from the other panelists, but there are some other important questions coming in.
Absolutely. So send me an email. I'll get that email right back to you today, and then you could forward those and be more than happy to get answers to you and post those. And again, I just encourage folks to go to our website. We've have so many new guidance and materials posted on our website about literally A to Z that I think folks would find really helpful, you know, if they visit our website. So, you know, I encourage you again to stay on like really good sites for really good, accurate information, whether it's LA County, the city. I know you guys are posting a lot of great links as well to CDC in the state. You know, I mean, there's a lot of noise out there, but try to be focused on, you know, those really good websites that have good, accurate information for y'all.
Thank you.
Well,
So we'll email you some of the additional questions and we'll get those answers posted on our website later today for those individuals who have posted in the Q&A, just so the other panelists have a chance to speak.
And
thank you.
Thank you, Dr. Alvarez, for taking the time to join this town hall meeting today. It really meant a lot. Thank you.
Thank you.
You're welcome.
Our next speaker will be Dr. Tanya Altman, who is a local area pediatrician, and she's here to talk to you today also about COVID-19. Doctor.
And Tanya, maybe you want to see, there's some questions in the Q&A, so you might want to.
I saw that. Yeah, I figured, thank you all for having me here. I definitely don't want to repeat, you know, what Dr. Alvarez said, you know, thank you. But I do want to say that, you know, I am in touch with a lot of private practice doctors in other communities. And I do think that Calabasas is doing an excellent job, really being, you know, ahead of the curve in terms of guidance and, you know, really closing everything down, which is why we do have, you know, lower numbers here than other areas around the country. And even if you look at California as a whole, we are doing so much better than other states, you know, like New York. But that doesn't mean it's time to loosen things up. You know, we have to definitely still stay home, still hunker down, so that way we can, you know, really make sure that we all get through this and have a safe and healthy community. So I noticed some questions here about masks in kids that I thought I could maybe address. And I think the guidance that Alicia was talking about, that Calabasas City is going to be coming out with Friday to wear masks when you're leaving your house to go to grocery stores, doctor's offices, essential places, you know, is really key. And again, the masks protect the community from any germs that you might have. They don't necessarily protect you from, you know, catching other things. And that's why it's really important when you're out that you don't touch your face, that you wash and disinfect your hands, and that you still stay 6 feet away from others. Now, the guidance on masks for kids is something that is really being debated right now in the pediatric community. The American Academy of Pediatrics still to this morning does not have an official statement. But what it's looking like is under age 2, we really don't want babies and toddlers wearing masks. And the reason is that then they're rebreathing their own carbon dioxide, which is not safe. And for older kids, someone asked about their kids riding bikes. So my concern about kids wearing masks riding bikes is that the mask could slip up, it could obstruct their vision, they could then get into an accident. So I think that, you know, the best thing is that kids should be home. Kids should not be going to the grocery stores. If they do need to go to a doctor's office, you know, then I think, you know, again, having them stay away, protecting them. Older kids and teens, I think, will feel comfortable wearing a mask when they are in public. Younger kids, not so much. And again, it's more the safety that we worry about. So again, I would say kids should stay home. Only one adult from a household should be going to the grocery store, you know, limited to only once a week when absolutely necessary. But I don't think kids that are riding bikes in the community, you know, need to be wearing masks. Alicia, what other things there? Testing. I think, you know, testing over the last week, we have lots of testing available now everywhere in our community. And this is not, I have not heard of any community member having an issue in the last week getting tested if they need to. There are drive-throughs through public health available. If you qualify, and pretty much anyone, you know, can qualify. Most private practice offices in our community now are swabbing or directing you to a specific urgent care that can swab you if needed. And the results are coming back within 24 hours to a few days to a week, depending on what labs are being used. But I don't think that is an issue anymore for our community. And the reason, you know, a few weeks ago we were saying if you feel like you have the symptoms, or if somebody your house does, assume you have COVID, stay home, don't get tested unless it's really going to change the management. Those guidelines have sort of loosened up a bit. And the main reason is because we know that spread to family members is something that is happening that we're worried about. But also now, for those adults that are interested, once they do recover, in donating plasma, you have to have a valid positive test. So if that's something that you can do, I would recommend that you do get tested, so that way you can isolate yourself from your own family, not go out in public, but you can also be a candidate to donate plasma, which is something that can help others, you know, in the future once you're recovered.
And just somebody asked if we have any information on the 20 patients. We are not given any information on any of the people who tested positive due to healthcare privacy. We are just given a number from LA County Public Health without any details on where these people live in the community, what stage they are in recovering from the virus. We are not given any information.
Right. But know that public health is keeping track of these people and doing a good job to make sure that they stay home and are not out, spreading the virus to other people. So I don't think you need to be worried about the person that you're walking across the street from. They're one of those 20, because these people know that they need to be staying home and doing their part to protect the community.
And Tanya, a question just came in about getting tested for the antibody.
Yes, so antibody testing is becoming available. It's not quite yet ready for prime time, so I'm not aware of any private practices in the initial community that have that capability yet, although we've all ordered it. And I think in a few more weeks it will be available here and at the local hospitals. And that's something that we're also going to use when camps open up this summer, when schools go back in the fall, to help us know, who maybe is already protected and we don't need to worry quite as much about. So that will be another useful tool that we will be using to help protect the community and prevent spread.
Thank you so much.
Very good. Thank you for that.
Yeah, and I can stay on and answer any other questions, that come up later. I just didn't want to repeat what Dr. Frank Alvarez, already said. But thank you.
And please do stay on, because the process will be that after all the speakers speak, then if time remains and if we haven't already addressed some questions of the panelists, they would be able to answer them at that time. So please do. So thank you, Dr. Altman. I appreciate your time here today. Assistant Chief Drew Smith from the LA County Fire Department is here. I hope that he can provide an update as to what he's experiencing in his department out in the field and give us some good, useful information. Chief?
Absolutely. Well, good morning and thank you. First, what I want to start with is your fire family. And your fire family are those people that live in those stations a third of their lives. So the impacts to them is pretty significant. And we appreciate all the support that we're getting from the community to support your fire family. So I'll start with what we're doing first, is that we have modified our station routines to where we're a very tight-knit group. So our camaraderie at the stations and morale is high, but we're modifying our behavior by not being as close as we're used to. So we're in the larger stations, we're eating in shifts. We have the separation and distancing with our standard meals. Remember, your firefighters live at the station for 24 hours at a time, and sometimes up to 72 or even longer hours at a time. So we have to have those necessities with shopping and everything else that comes along with that. So we've really modified our behavior to meet the needs to protect ourselves and keep ourselves safe, so we can help and protect you when you call 911, whatever the emergency is. We're adequately supported with all the personal protective equipment to perform adequately. We're being well supported in that manner. We also have a health programs management system in place for all of our personnel, to where if they have an exposure, they're sick, whatever the nature is for them, that they're cataloged in health program management to where we can track if they're showing any signs or symptoms. But one thing that we're doing also is unrelated to COVID, is we do not want our people to come to work sick. So if they're having any sickness, regardless of what the origin is they're not to come to work sick. The management of a 911 call, we have seen throughout the county that the 911 volume has actually gone down somewhat. And what that means to me is the information is getting out there that calling 911 for the necessity of an emergency that's significant. So we've seen some of the routine 911 calls go down. And so with that, a 911 call that we go on, we don't want to send sick, moderately sick, or people that can self-medicate at home and or stay at home and get clinically well, as compared to shipping them to or transporting them to an emergency room to potentially do greater harm based upon an ER saturation, which we want to keep them for sick people, so the emergency rooms can help those sick people. So we have a telemedicine program in place, and so where the paramedics will go out, they'll do a patient assessment with that patient, and we also have the option to use the telemedicine, which is an iPad basically, and you can talk to a physician and or a nurse practitioner to get adequate care. And if it's determined that their best care is to stay at home, that's the route that we're going to take and provide that for that patient, also with follow-up with that patient if need be. So that is new to us, and it's actually it's very, very efficient, because we want to keep that high efficiency and optimal customer service delivery to the community, and we're doing that. This is a moving target for us. I talk about our firefighters. They're also changed their behavior. Remember, they go to work, they go on their 911 emergency, so we're still going to the car fires, structure fires, cat in the tree, whatever it may happen, that we're doing that. And when our firefighters are going home, they're doing their own internal safety plan as well. And that is coming in through the garage, they're disrobing or getting undressed, they're being sent to take a shower, and then they interact with their families. So we're taking every precaution we can so we can once again maintain that level of customer service for our citizens out there. And with that, that's all I have, and I'll look or entertain any questions that we may have. So we appreciate from the fire side, I know the law enforcement side, all the support that we're getting from the community.
Chief, thank you for that information, and it is useful information, really something that you just brought out. You know, they come in, they disrobe, they take a shower before interacting with other people. I think that's a very good direction that people should follow. So thank you for that. I also see Megan Courier is here. I don't know if you have anything to say, or just be available for questions and answers at the end, or at this time, do you have anything that you'd like to add?
Yeah, I don't have anything specific. I think Chief Smith covered everything really well from the fire department standpoint, but I am available. If any community members have any questions or anything, they can contact me directly, and I can connect them with the right person or help them out.
Well, thank you. You've always been around to answer questions, been very supportive, both you and the chief. Thank you both.
Thank you.
Lieutenant Hector Mancinas is the person in charge now of the Lost Hills Sheriff Station. He is here today, and I hope you have a good update with regard to what the sheriff is doing.
Good morning. Thank you for having me. Like you said, my name is Hector Mancinas from the Lost Hills Sheriff Station. I am filling in for Chuck Becerra. First off, I want to thank the mayor and the city council for having me. And I want to thank all the citizens for all the support we've been receiving here at the station. Let me provide you with some quick crime stats for the month of March. For the month of March, the city of Calabasas had 3 residential burglaries. Regarding two of those residential burglaries, we've already had arrests made. On March 19th, another call for service. 7 persons were seen ransacking a vehicle in the middle of the night, and deputies were provided with descriptions of the suspect and the subject vehicle. They located the vehicle and detained the occupants. They found that these individuals were going around the city and stealing catalytic converters, and had cordless power saws with them. All 5 suspects were arrested. Just to give you an update on crime stats in comparison from last year for the same month in March, Part 1 crimes are down 27%, which include robberies, burglaries, and petty thefts. Calls for service are down 16%, which is likely cause for our current pandemic state. First off, all of our station personnel have been coming to work. They show up every day to take on these current challenges. As the chief said, we are all advising our personnel to stay home if they feel that they have any symptoms, which they are all pretty, they've been all following that. Thankfully, we haven't had any here at the station. To give you some insight on how we are changing our deployment here to this COVID-19 pandemic, we are using our detective personnel and community impact teams to stay out in the field to be visible. We are utilizing different personnel from different units of our department, such as court services and our specialized units such as detective division, to assist us in being highly visible. all the deputies that are out in the field have been provided with personal protective equipment, such as gloves, N95 masks, and goggles if necessary, as well as all the personnel here at the station. While the deputies are out there, they're constantly reminding the public of social distancing and educating the public to help flatten this curve. Obviously, we want to get through this the state that we're experiencing. As we're constantly learning from this pandemic, we have modified how we take calls for service. If you happen to report an incident and require our response, you will be asked a series of pre-screening questions to help determine the type of response, such as do you have a cough, shortness of breath, a fever. This information will be provided to the responding deputies. Like I said, this thing is new to us, like everyone else, and we're constantly learning, so we are adjusting. We are open to any comments or questions, and I'm here available if you have any, sir. That's all I got for now.
Thank you.
Thank you, Lieutenant. I appreciate you being here and sharing what the department is experiencing through this pandemic. Moving on to Dr. Dan Stepanowski, who is the superintendent for the Las Virgenes Unified School District. He can provide any sort of information regarding what the school district is experiencing through this. So, Dan?
Thanks, Dr. Lesick. Happy to be here. I appreciate the support of the staff and the entire community in these challenging times. So proud of our staff and parents, students. There are 80 school districts in LA County and 20 in Ventura. Las Virgenes is in both LA and Ventura County, and Las Virgenes was the first of those 100 school districts to close and announce our plan to reopen. Closed for 2 days and relaunched within 2. Most school districts in the region have waited a month. We work very closely with Mark and his team at Viewpoint. They've done an excellent job, and we appreciate the close partnership with them as well. Can't thank our parents enough. This is challenging. Closing 14 schools. We're the largest employer in the region with over 1,100 employees. So their safety is paramount, especially in relation to public health and well-being. So it was tough. Mark and I didn't get into education to not have lots of kids around. We want the kids around. We want the schools full. So this is heavy time and challenging time for all of us. Also proud to do our part. Our science teachers at Calabasas High School remembered that we had all kinds of medical gloves for different experiments. And so they told the plant managers, go into the storerooms. We found 4,600 medical grade gloves we gave to Kaiser and West Hills. Our maintenance staff also remembered that we had N95s from Woolsey Fire. I suppose the silver lining from Woolsey Fires, we are all battle tested. And so we had 2,200 N95s we also gave to Woodland Hills, West Hills, and Kaiser. We hope to open sooner rather than later. Obviously, the governor has us closed for the rest of the year, but we hope to get open soon. Probably the biggest questions out there are for our seniors. Our heart goes out to all of our seniors. We love you. We miss you. We know how challenging this is for you. There's all kinds of senior activities, proms and graduations and grad nights. We are being as creative as possible. The principals will get a survey out to our students soon for ideas. Obviously, public health and safety and our staff and students' well-being comes first, but we're going to be real creative and come up with some good ideas and share them with Mark and see if Viewpoint doesn't have ideas as well. Our 5th and 8th graders also impacted, and so we're going to be checking in on them. We have great resources at community360.me. Not only were we the first district to relaunch public school, to relaunch our distance learning, but we've also pushed a bunch of innovative programs. So if you go to community360.me, we have counseling services available to all of our students, their families, and our staff. You can schedule appointments, all virtual. We just launched a tutoring service too. We have 100 high schoolers who are providing individual virtual tutoring sessions for our K-5 students. We're going to open that up after spring break to middle school and then to high school. We've already had 500 30-minute sessions with our elementary kids, everything from reading books to them to going over math problems. Very cool stuff. Finally, you're going to hear a lot in the news in the near future about grades. Some districts going credit, no credit, some districts sticking with grades. So we're exploring it. We're going to be purposeful. We're going to be thoughtful. We're researching what districts are doing out there. We'll come up with a thoughtful plan and hopefully have that in place and out to parents the next couple of weeks. Thanks so much for the time.
Thank you, Dan. And also, I just wanted to thank all the teachers for everything that they're doing. I mean, to get public and private schools to move school online is something that I don't think anyone ever expected. And as a parent of 2 kids, I mean, they're in school right now. Their day's functioning just in our house. So thank you to the teachers, and a huge shout out to our first responders, fire and sheriff. I mean, we appreciate you so much, and the fact that nothing has changed in the service to our community. So we are just keeping everyone's health and safety is our first concern, but thank you to everyone in fire and law enforcement. So thank you.
Very good comments, Alicia. Thank you for that. And thank you, Dan. Moving to the head of school for Viewpoint School is Mark McKee. He's joining us. Looks like maybe from his office. I don't know, but Mark.
Gary, thank you. I'm joining you from actually my home office, setting an example of social distancing. And I also want to thank the mayor and thank you, Gary, and thank the city staff for holding this town hall. And also say a huge thank you to all the members of our Viewpoint community who are tuned in, to our neighbors, Viewpoint's neighbors, and to our broader community. We really value our place in the community. And I really echo some of Dan's comments about all of us in education. It's very hard to be running a school. Typically, all of our students are in classrooms, and we've now pushed classrooms out into hundreds of homes all across our community. And so that also means a thank you to our parents. Alicia, I really thank you for understanding the work that is involved. If you'd asked, I don't know, if you'd asked Dan or me what it would take to make schooling remote, we might have said, oh, give us 3 years and we can plan that and execute. And instead, it was much more like 3 days. So I really thank everyone for their patience and understanding and the support of the teachers and parents who are together making this happen. We did decide, and very much in concert with the mayor and the city, and with Dan and Los Virgenes, we decided on March 11th to go into remote learning mode, and we've been remote since March 11th. We've been remote since March 16th. So we had 2 weeks of remote learning prior to spring break. We're currently on spring break, and so far we've announced publicly that we'll be remote through May 1st, but we are prepared, certainly following the governor's orders, to be remote through the balance of the school year. And like Dan, we're contemplating and making plans for the possibility about end of school events, and similarly holding out hope. We have been doing a great job with social distancing as a community, and the scientists on our COVID-19 task force have been advising us about how it really does seem to be working for our local community here in Los Angeles and in California. We currently in spring break, learning doesn't stop. I know we have about over 250 of our students who are engaged in pop-up spring break courses and other things that are happening over spring break. We currently have both Viewpoint teachers and students engaged in making PPE. So we have put the 3D printers in our innovation spaces to work manufacturing face shields. And like Dan, we've donated the PPE from our science department to West Hills Hospital, and we'll have donations also to Kaiser and to local hospice organizations as well. So I think Tanya might have a face shield from our laser printer, from our 3D printer right there, which is really great. So that's kept our teachers busy over spring break, working with our students and others in our community. And so we thank the community for the support of that. And we've similarly been keeping our community connected. One of the hardest things, and for all of the parents and grandparents out there, you probably know this, one of the hardest things for students, both children and teenagers at this time, is staying connected. So much of the experience of school is social and emotional, and we've all been learning new ways of being connected with our teachers, with one another, through this period of remote learning. It will be very interesting to see what the field of education learns from this time. A huge shout out and thanks to our healthcare workers. I want to echo the words of Chief Smith, and that we similarly, most of our 300 employees are working remotely, whether it's our teachers who are teaching remotely or many of our office employees are working remotely, but we also have employees coming to work every day and observing social distancing guidelines. And we're similarly asking people who are not well to stay home. But again, the work of education keeps going. And I really thank you all. The final note I'd say is to all the parents out there, to remember to take care of yourselves so that you can take care of your children. The number one protective factor for both the physical health and the mental health of our children and teenagers is the health of the primary caregiver. So parents have an important role to play. And that, you know, our children are really our future. Educators know we touch the future. And so I know, think about what stories they will have, what memories they will have of this time when, as a people, we all together, you know, worked to flatten the curve, and the memories that they might have of the time that they spent either remotely with friends and teachers, or most especially in connection with families. So hopefully these are very challenging times. Hopefully we can all find what opportunities they contain. And thank you.
Thank you.
Mark, thank you very much. And Dan, thank you as well, because the community is so invested with our children. And so I really thank you both for being here and sharing with us today. From the Las Virgenes Municipal Water District, where we get our good tasting clean water every day, Dave Peterson, please, Dave.
Good morning. Thank you, Dr. Lysick, Mayor Weintraub, and members of City Council, and all of those of you who are at home and participating. On behalf of the Water District and our Board of Directors, we value the partnership with the city and with the county, and really appreciate your leadership in responding to this crisis. There's three things that I wanted to share with everyone. All of them are described in more detail on our website at lvmwd.com, but I'll cover them real quickly. Number one is that your water is still safe to drink, as it always is. There is no evidence at this time that COVID-19 is or has been transmitted through any of our water systems. And our water systems, we treat our water for a variety of things, and specifically for bacteria and viruses. So there's not a need to rush out and buy bottled water. It is always good to have bottled water in the event of an emergency, more like an earthquake. What we recommend is 1 gallon per person per day for 3 days. But now is probably not the time to rush out and get that. So just wanted to put you at ease that your water is safe. Number two, or the second item, is if you're using disinfectant wipes, which a lot of people are, we just ask that you put them in the trash rather than flushing them. When you do flush them, unfortunately, those wipes, they have sort of a fibrous nature. They don't disintegrate, and they begin to clog up our sewer system and can create another public health and safety problem. And then number three is our board is really mindful and aware of the impact that this is having on all of you and all of our customers. And our board has asked us as staff of the Water District to look for ways that we can help to minimize the impact and soften it. We have frequently asked questions that we now have available on our website, and I would encourage you to go there. The board did declare a local emergency. They did that with in mind customers, and taking actions and authorizing and empowering staff to take all the actions possible to soften the blow on our customers. There's three things we've already put in place. Number one is that we are not shutting off anybody's water for non-payment. You may have read the governor subsequently made an order statewide for that. We're not hanging the door tags that no one is fond of that say that we will be shutting off your water. We're not charging fees associated with that. And we're also being really flexible on waiving all of our late charges for your bills, realizing that people are not focusing on paying their bill as their number one priority. We do ask, though, that you continue to pay your bill if you can. And the reason is it's essential in order for us to continue our function and our operation, which is an essential function. And then just lastly, I would encourage you, if you're having difficulty, if you've lost your job, if you're concerned about your ability to pay your bill, just call us. We're all still available. We're not in our office, and our office is closed to the public, but all of our employees are essential workers, and we're working from home, and our phone numbers remain the same, and you can reach us, and we will do everything possible to help you. Thank you.
Thank you, Dave. Oh, Gary, you're mute. Oh, there.
Yeah. Can't keep me quiet. Really, thank you for that useful information. There have been some questions regarding water, and I'm glad that you were able to clarify that and put everybody's mind at ease. So thank you for being here, David. From the Chamber of Commerce, it's my pleasure to introduce Bridget Carl, who is here to talk a little bit about local businesses. So Bridget.
Thank you, Gary and Alicia. Just so that the business community is fully aware that on our website, there is updated information, and we update it on a daily basis. We also send out messaging through email blasts and social media. The positive thing is the SBA has now streamlined their loan disaster assistance in a simpler form. There is no more information that needs to be given for financial background, collateral, and so forth. That new loan application is on our website, but I also sent it out via an email. So that's very positive. The payroll protection, a lot of the banks were slow to get started outside of Bank of America. Chase now has started to accept applications for the payroll protection. It was originally called payroll payback. So some of that money will be forgiven. And so it's still being worked out. It was part of the $2 trillion add-in. But again, there were 6 phases of that stimulus package that I think they're on phase 5 now. So phase 6, once that's completed, people will have a better understanding of what money is available. There's other resources available too for people to look for extra funding. Some of them are through the SBA. The state of California is providing some sort of funding. There is an application also on our website that could also defer whether it's tax liabilities or any type of loans in advance. They're going to enact that right away. So some of the concerns that our businesses have obviously is based on healthcare and payroll. If they go on unemployment, their employer who was covering their healthcare no longer can cover their healthcare. So there's this partial unemployment that is trying to be worked out so that healthcare could be covered. So a lot of unanswered questions still, but I think that the SBA is really stepping up right now. They have assigned a representative for each Chamber of Commerce. I just was assigned somebody by the name of Kevin last night, and he is available to answer any questions that I can't answer. And the Chamber, with some board members, have been supporting the businesses filling out unemployment forms, trying to fill out the different SBA loans and so forth. So just so that the businesses know, and if they're on this webinar, that if they were denied an SBA loan, say last week, they can reapply now on the faster, streamlined application, and they shouldn't be denied. So they're depositing the money directly into their bank account with their routing number. So that's very positive. We have been updating several businesses on what the collective coalition of the Chambers of Commerce are doing. And part of that is we are working with our local representatives on insurance claims. So quite a bit of the employee insurance, employer's insurance does not cover pandemic. And we're trying to get that adjusted through the United States Chamber of Commerce and California Chamber of Commerce. So we're trying to get it reworded so that loss of business can be covered through our insurance that we pay through our employer insurance. I'm with State Farm. There's other companies that are reviewing it, but we have to really get a coalition together to force it through the federal government. So that's been very active, and we're hoping that that has legs and that it would be able to help these small businesses. As far as the chamber and the board of directors, we're trying to put together a list of businesses. We did outreach asking businesses if they are suited to support other businesses free of charge for different types of services, whether it be website, messaging, or whatever. We're looking for that. We're looking for attorneys also to help with employee situations. And employers, so we're not discriminating, just doing employees. So there's a lot of positive feedback that I'm getting from that, so I'm happy about that. The one thing is we've been on calls with Senator Stern, and obviously he has a lot of information with the city of Los Angeles. So businesses in Calabasas cannot apply to the city of Los Angeles for business loans or support loans because they're in the city of Calabasas. So that was some clarification we needed to clear up for those businesses. Let me see. And then we are in the process of trying to understand what is real and not real. So we're trying to spearhead what is false information. If people are giving information on, types of cures or testing that is not legit, and profiteering. We had some businesses trying to make more money on masks and things of that nature, but that has subsided. But we are concerned about businesses in the community doing outreach to other members through Nextdoor or any other type of social media that is offering, cures or things of that nature. Tanya helped me with it last night, so I appreciate that. Thank you.
And Bridget, make sure all of that information gets sent to Lost Hills Sheriff Station and Gary, because the city has an executive order about price gouging. Right. And I know that Lost Hills will help us in making sure that businesses are not operating in this, doing illegal things. So
right. Thank you. And then the other thing is, people are still in business, and some people have to sell items in order to survive. So if somebody's selling something that is of retail value, has not increased their pricing, not everybody can donate and lose their profit line. So let's be aware of that. And there's been a little social shaming out there. And we really have to be understanding of businesses still trying to stay open and make a profit, or just add to their bottom line so they continue to pay their employees. There are several businesses in the city that are continuing to pay their employees because they are providing health care. And it's really starting to take a toll on those businesses. So, I did present that proposal to the city council, which I guess we will talk about a little bit later, and hopefully there's something that we can address and work out. And just one more thing is takeout has slowed down a little bit for the restaurants, and I think because people know that it's a longer stay of quarantine, that they're starting to scale back on doing their takeout. So just if you could do it once a week and support the businesses, they're really trying hard to, again, pay their employees and so forth for healthcare. So any other questions, you can certainly email me at the Chamber of Commerce, but visit our website, calabasaschamber.com, and all the latest information, update applications and so forth are available.
Thank you.
Yeah, thank you, Bridget. I was just going to say that you should provide your website address, and it is calabasaschamber.com for all
Correct.
the information that Bridget just talked about. I'm looking at, we're coming to the close of this, but there is one question here regarding, well, there's actually a couple of them, so I'll just try to group it together, and maybe Dr. Altman or anybody else on the panel, of which I am very much pleased that all of you were here, really. I'm just looking at your pictures, and these are the leaders and the people in charge of this community, so really thank you all very much. Are there any grocery, as there are many grocery stores that now have many employees that have tested positive, is our food safe? I mean, that is the question, and that's, others were asking similar questions, but this one particular one came from the community Angela Farmer.
Sure, and I think that's a really good question. There's no evidence that food or water, as we mentioned before, can transmit the virus. Especially the cooking process, should kill it. So what we're recommending is that when you get your groceries home, that you wash your fruits and vegetables as you normally would, and that should be fine. That you wipe off any containers. Similarly, when packages are delivered to your door, you can open the box outside, take the contents inside, and then wash your hands and dispose of the outside container. But I'm still going to the grocery store, once a week. I haven't had much luck with delivery. So I'm doing that carefully. And we're also trying to support local businesses by ordering in once a week, as Bridget mentioned. And I do feel that there are safe ways to do that as well.
Gary.
Yeah.
Before we head off, can Jeff just briefly tell the community about our online community programming?
Jeff.
Good afternoon.
I saw your advertisement today. It looked really good.
Good. We're hopeful to get everything out to the community today and tomorrow. Many of our classes that were supposed to start as part of our spring and summer recreation brochure, we are starting about 30 programs as of this morning, I think is what I reported, are available to register for online at citycalabasas.com. We're doing Zoom programming, so it's all online in the comfort of your own home. We upgraded our Zoom program yesterday so we can have up to 500 participants. That is quite a bit, but we had several classes that already had over 100 people enrolled, and that was the max at the time. So we're starting youth and tot programming coming up this week. We also started at our Calabasas Clubhouse preschool. We have online Zoom programming with our teachers, courtesy of Little Learners. They're doing a fantastic job with that. We're doing on CTV. We have some fitness programs. I know somebody put a comment about some fitness. So there's some fitness programming that's on our CTV website. We're also starting some fitness classes as part of the Zoom programming, so you'll be able to register for that as well. We also have a face mask or mask initiative that I'm just looking at the flyer. It just came to me a couple minutes ago. We're looking to put people together, those that are in need of masks, those that want to make masks, or those that want to donate masks. We're going to have something on the website a little bit later this afternoon to help get masks, face masks to everybody. So staff is very busy. They're doing a fantastic job. We hope by the end of the week or early next week, we'll have up to 50 or 60 programs online that we'll be able to participate in. And obviously, we hope to get everybody back to the parks at some point shortly. But again, if you do have some program ideas, things that you would like to participate in, please feel free to send us an email, and we'll do the best that we can to get those going.
Thank you. And then maybe Maureen can just give an update. I know there's a lot of questions on a daily basis about construction.
Thank you. Yes, construction continues. It's considered an essential service, but construction workers must also follow social distancing guidelines. It's an area that if you see a congregation of workers, please get in touch with the city. Please let us know. The orders that the mayor spoke of that'll come out this Friday are going to contain greater restrictions for people who are not taking care of their employees. And let's face it, a lot of construction sites are actually outfitted with day laborers. These are individuals who really may not have health insurance, may already be struggling with financial issues in the crisis. So they migrate to good opportunities like jobs in construction. But we also want to keep them safe. So if you have people in your home, they should be wearing masks. they should actually be out there practicing all of the social issues, washing their hands, making sure that they stay safe around you when they're working in your kitchen or working in your bathroom or working anywhere else. So do let us know. Our inspectors will go out and give them a good reminder of what they need to do. The new orders will be stronger and allow us to shut down a project that isn't practicing social guidelines. So we thank everyone for working with us remotely. All our staff is on Zoom meetings every day. We are personally answering any questions that come into us, either by email or by phone. So stay safe, get your work done, and if you need help, we're here.
Thank you.
Yeah, very, very good comments. And so I guess while we're at it, I only just want 1 minute. If you guys, either Jim or Robert, have anything further to say. Jim is the Public Safety Director, Robert is the Director of Public Works. Is there anything to add to this meeting before we sign off here today?
Well, someone had asked to chat about the flu clinic and whether we were still going to have it. It is tentatively scheduled for October the 10th. And we'll have to wait and see how this all plays out, but it is scheduled. We'll find out whether public health will allow us to continue it.
Thank you.
Dr. Lysick, thank you again for having us. Public works staff are out in the streets, landscape maintenance happening. I saw a question, can private gardener do their job? Again, as Maureen mentioned, masks, social distancing, limited crew, try to limit the type of work that you have at your home, and signals will be functioning properly. I have staff working on those. And just work with us. If you have any questions, specific concern, email us, we will respond back. Thanks again.
Robert, just one question. There was a question that came in, and I've heard it from multiple people. Just with more people using our sidewalks, what can you say about people walking in streets on the opposite side? There was a question that came in.
Well, again, social distancing, try to be safe. There is not much traffic in the street, and that's more dangerous. So be careful when you walk in the street or trying to cross the streets. Last question or last concern that I've been hearing, a lot of people walk their dogs, but they're not cleaning after the dogs.
Yes.
Even though they clean in the bag and throw the bag around, please do not do that. We are limited on resources. We will do our best to help everyone. But again, the sidewalks are safe. Try to practice as safe as you can and try to cross each other within 6 feet distance that is required.
And I just saw a question come in about testing, and we would love to have a testing facility in Calabasas. Right now, the county does not have us on any list for testing, but our public safety director, myself, and our city manager have a call tomorrow to discuss this and to explore if there are other options. The testing facility in the city of Malibu was not set up by the county. It was a private endeavor. So our city is looking at if there are any opportunities, but right now the county has not chosen Calabasas as a testing location.
Well, good.
Mark.
Alicia, in case more funding comes through, that testing in Malibu that was set up by the Malibu Foundation, I know about this because there was a Viewpoint parent physician who helped set that up, was also available to residents of the Woolsey Fire area. So it might be applicable to members of our community. I know that they got approval for Monday and Tuesday, and I'm sure that they're looking for approval again. So people might watch the Malibu Foundation website for that.
Thank you, Mark. Thank you.
They are seeing Calabasas residents there. I've sent some.
Okay, well, good to know. So the Malibu drive-thru, and that's on the City of Malibu's website. And I know you can go on to do some pre-screening that I looked up as well.
Well, excellent. Any final words from either Mayor Weintraub or Mayor Pro Tem Bazagian before we hang up?
Just a huge thank you to this panel, for everyone, to our staff, first responders, our doctors in the community. Everybody is working above and beyond to keep our community safe. And thank you to our residents for adhering to the stay-at-home order. And we'll just continue to do what we can to keep our community safe. So thank you.
Yeah, this was very informative. Thank you, staff and Gary, for having set this up. I thought it was excellent.
And thank you to the rest of our council colleagues. Due to the Brown Act, they were not able to have their faces here, but all 5 council members are doing everything they can to keep this community safe. So thank you to our colleagues who are dialed in on this call, but you just can't see their faces. So thank you.
And
Hi, everyone.
for all the members of my staff at the City of Calabasas, some of which are here today, but many of which are not.
I think Gary's mic is going out, but I know he's trying to say thank you to our incredible staff. So for everything that they are doing.
I am. So thank you all, and thank you for being here.
Thank you. And with that, we will end this town hall. Thank you. Bye.
Okay.